Love Your Lungs Week. It kicks off next Friday. It's a time to remind everyone about the importance of taking care of your lungs.
Lauren Ferguson and Dreama Perry from the Marshall Health Network are with us once again to tell us about lung screenings and why they're so important.
Yeah, so great to see you all.
Thank you for having us.
Yes. Okay, talk about, for folks at home, what is a lung screening? Because most of us have probably never had one, and why is it so important to get them?
So lung screenings are a CT scan, and we're trying to find early stage lung cancers.
Okay.
Lung cancer is one of the second most diagnosed cancer in the country.
Oh, it's second.
Really?
Wow.
Yes. And then more relevant to our area, it is the most common diagnosed cancer in West Virginia.
And is that simply because of the number of people in this region who smoke?
Smoking, industrial, just workforce. I mean,
okay.
Yeah. Okay. And then of all those, if people are diagnosed with lung cancer, only about 20% of those are caught in the early stages.
Only 20%?
Yes.
So that's another reason to get screened.
So one way you can do that is with the lung screening. So it's a CT scan that scans your chest. We're looking for any kind of nodules, masses that might be there when they're in the earlier stages and more of a curative, because unfortunately lung cancer has the most cancer-related deaths.
Yeah, that is the unfortunate part. So that's why getting these screenings done is so important. Is there, do you have a criteria? Is there a certain criteria that has to be met? Are there guidelines that people need to meet before they can go for a screening?
They do.
They actually do. The ages of 50 to 77, that's our first marker. And then you do have to either be a current smoker or you have to be a past smoker. And if you've quit within the last 15 years, we can actually do a screening on you as well. So they'll call it a pack per year history, but a lot of people don't really understand, hey, how many packs per year have I smoked?
Sure.
Ask your doctor, call our line, we can help you formulate
figure that out.
Yeah, that's a lot of people, actually. When you think about that, and you include past smokers, and especially, as you said, in this area of Appalachia where the smoking rate is so high, you conceivably could see a lot of people come through that door.
It's definitely a very underutilized screening, so it's one of the things we're trying to really drive and get out into the community and talk to your family doctors about it, and because there's a whole lot of population that we're missing.
Exactly. Okay, so what can you do to help people once they have found out that maybe there is a problem?
So if we find out there is lung cancer, or if you have issues, just chronic lung issues and stuff, between both facilities at Cabell, St. Mary's, Rivers Health, we have programs like at Cabell. They have the Lung Health Center that has different providers that are in there. We do testing like pulmonary function tests. Both facilities have pulmonary rehab, so people that have chronic lung disease, there's an exercise and education program that they come in and are able to kind of rebuild themselves. If you are a smoker, we offer smoking cessation classes, which we try to kind of pair with the lung screening. So if you're still smoking, we try to, really encourage you to get into one of our smoking cessation classes.
Yeah, that's so important. There's an old thing from oncologists where they talk about how people are afraid sometimes to even go in. So they're starting to, maybe they recognize a symptom or two. They think maybe this might be it, but they're afraid to go in and commit because they're afraid. But that's the thing. Their treatment is so much better now than it was 10, 15 years ago. So the survivable rate, there is the second highest rate, but still people can survive now today that weren't able to survive before.
And early detection saves lives, so that's what we really want to kind of drive into people.
Yes.
Absolutely.
So don't put it off. Get in there as soon as you can. Remind everyone, if they want to come in and get screened, what's the best way to do this?
They can actually call in. Marshall Health Network has actually designated a specific line, and I think it should be on the screen, 781 Lung.
Okay.
You can call that number. We have somebody that will go through the initial screening questions for you, and if you qualify, then they'll forward them to either myself or Laura. And we'll go through a full screening process with you, discuss basically entail what this provides, what we can do for you, and enroll you in the program. Our goal, of course, is to get you in the program, but we also want to maintain you in that program. I mean, if you're 50 years old and we can scan you till you're 77, that's very important. So annually, you'll be able to come back every year and have this screening done. And if we find something, then we'll refer you to the pulmonologist, or Miss Laura can see you at her office, and we can continue to monitor that.
Okay. Well, husbands, fathers, grandfathers, it's your day coming up this weekend. If you know somebody in your family who smokes, husband, father, maybe now do them that favor.
This could be the best gift.
Right. Give them that gift of calling and getting an appointment and see if you can get them in. Yes.
Thank you so much for coming. It's great. It's great information.